My name is Kaylin Van Camp, and I'm a senior here at Saginaw Valley State University. For my final class, I chose to do my internship at Covenant Healthcare here in Saginaw. I was part of the physical medicine and rehab program, but more specifically, I was the oncology wellness intern. To start, I'll talk a little bit about what my individual interests are. Over the last 4 years, I have narrowed my study to clinical exercise physiology, focusing primarily on the oncology population. This population interests me because so many people have been affected by cancer, whether it be having a diagnosis or knowing someone who does. Cancer has become one of the leading chronic diseases, and this subject has so much new research being conducted. Advances are being made on the topic every day. This research includes diet and exercise being modifiable risk factors. This led me to my internship. Like I mentioned previously, my internship was with Covenant Healthcare, and I was located at the Cancer Care Center on the corner of Tittabawassee and Mackinac. Our department was physical medicine and rehab, and we were located in the basement of this campus. My supervisor's name was Morgan, and I've included her contact information in this PowerPoint. I chose to be the oncology wellness intern because it was working directly with the oncology population. Working with wellness within this population fit my interests perfectly, and because it was located in Saginaw, my travel time was less than 5 minutes. Taking this internship allowed me to work within a major healthcare system in the Tri-Cities. Prior to starting my internship, I laid out a set of goals I wanted to meet by the end of the 16 weeks. My first objective was to independently lead an entire group exercise class. My second objective was to learn to apply special considerations in an exercise setting for the oncology population. My third objective was to learn and administer fitness testing to track the progress of the participants. My fourth objective was to be able to better access and research articles. My last objective was to be able to complete data entry and process payments to get a better understanding of the administrative portion of the job. My supervisor was great in giving me tasks that helped me to reach my objectives. Every day, I would arrive at my internship and set up the room for exercise class. Unfortunately, the program doesn't have its own space. Hopefully, if you're a future intern, they will. So we would be located in a conference room. I would push a cart with all of the equipment to the room and set out the weights for the participants. I would set out the rest of the equipment to be used during class. The bottom picture on the screen is a typical setup for our exercise class. I would also set up the room for yoga. On the other side of the conference room, we had mats, blocks, and towels for the participants to use. After yoga and at the end of the day, I would load everything back on the cart and take it back down to be stored until the next day. After class on Wednesdays, we would wipe all of the equipment. Working with the oncology population, it's very important to stop the spread of germs. It was also my job to lead the exercise classes under supervision of my supervisor. Every day, we would begin class with a warm-up and arm circuit. We would then go into circuits in which I would come up with the exercises for the participants to do. I had to be sure to make alternative exercises or variations if a participant had any limitations. I also would address problems with form and engage with the participants in conversation. After circuits, we would either do balance or band walking, and then end class with normal walking as a cool down. At Covenant, classes run for an 8-week session. At the beginning and end of each session, we would do fitness testing of the participants. I would help my supervisor administer these tests and record data. The testing measured strength, flexibility, endurance, and balance. I would explain some tests and record data for all tests. The photo on the screen is a picture of the hallway that we would use for our 6-minute walk test. For the 6-minute walk test, the participants would walk from one end to the other end and back, and that would be 60 meters. We would continue the walk for 6 minutes. At the end of 6 minutes, the participants would stop and look to their right, and we would record the number closest to them on the wall. And that's how we would do the 6-minute walk test for the participants. My responsibilities, however, didn't stop in the classroom. In between classes, I was responsible for data entry. I would enter data for fitness testing and payments. This was important to document so that we could continue funding for the program. I would also research current articles that supported using exercise as a supplemental treatment for cancer. I looked for articles that supported exercise before surgery and the benefits yoga could have on cancer-related symptoms. I also worked on many projects for the department regarding cancer care. Some of these projects included a Starting a Walking Program brochure that gave tips and facts about starting a walking program on your own. I completed a What is Lymphedema brochure that outlined what lymphedema was and what treatment options were available for patients. I also started a Tip of the Month project where I created handouts with a tip regarding health and wellness to be passed out at all campuses. Additionally, like I mentioned previously, I did a lot of research regarding the benefits of exercise to cancer patients. I thoroughly enjoyed my internship and could see myself one day holding a career in a position like this. In order to do this, I would get my certification in clinical exercise physiology and become certified as a cancer exercise specialist. To improve my ability to teach the classes, I would also get certified in yoga and group fitness instructing. In conclusion, I would highly recommend doing an internship with Morgan at Covenant. There's a lot of additional things that you have to do prior to the internship and a little bit of extra money that you have to spend, but I would definitely say that it's worth it. My only advice to you, regardless of what year you are in or what level you are at, it is so important to gain experience. Take advantage of all the kinesiology program has to offer you. Take time to do exercise testing, get involved in research, and join the associations made available to you. Also, get in with the faculty. Don't be afraid of them. They want to see you succeed and will help you in any way they can if you put forth the effort. Lastly, you don't have to know what you want to do. As a graduating senior, I'm not even positive what I'll end up doing one day. But go out and observe and volunteer to get an idea. Experience is never going to hurt you, and everything you do now is going to impact your future. I hope that this PowerPoint gave you information on the Oncology Wellness internship at Covenant Hospital, and I hope that you choose that site as either observation or as your internship site in the future.